Hi everyone, Al the Psych here. I have a video for you today for informational purposes only. I've entitled it Exposure Therapy for Anxiety. There's more to it than that. But basically I was just finishing up a online seminar about anxiety, and they talked a lot about exposure therapy as well. I thought I'd go over some of that information. Um, so just for a quick reminder to get past the anxiety, or at least to deal with it efficiently, some level of exposure therapy can really help. Now, it's not necessarily going to extinguish your anxiety, but that's okay. All we're doing is maybe all you might need is to take the anxiety down a notch or two to be able to easily or tolerate it. Basically, that's what we're talking about, is just basically tolerating it. So the idea behind the exposure therapy is to basically develop a tolerance of the anxiety-producing situation. So if I have an issue with going into stores and making a purchase, for instance, I can systematically work on tolerating going into the store, to the point where it's no longer an issue. I do it and it's like, yeah, I've kind of habituated to the anxiety. It's like it's there and like it's, so what? Okay. I might go into the store, see how I'm feeling. If the anxiety starts, I stay with the situation until the anxiety subsides. And if I've got, the like adrenaline running through my veins, cortisol, the stress hormones, things like that, usually it's going to be there for about 15 or 20 minutes, and then it's going to subside. Okay, so if I know that, it's like, okay, I'll get past that. You might even have a little mantra, yeah, I'll get past it. Now, the important thing, though, is not to bail on the situation while anxiety is pronounced. You don't want to leave the situation. You don't want to leave while the adrenaline and the cortisol is running high. If I bail on the situation, I'm just going to make the anxiety-producing situation seem that much more difficult. It will be that much more difficult to get past. Think learning theory here. So basically, I just have to write it out for a few minutes. Okay, I know it can be scary, but it's just a few minutes. So I would recommend starting with anxiety-producing situations that are not over the top, and you kind of get used to the feeling of being successful. That really helps. It's like, yeah, I did this one before, I was successful. I did that one before, I was successful. Okay, yeah, it just kind of helps with your cognitive thinking, that part. So if I've had success going into the store, I may pat myself on the back, yeah, I did it. And then I can proceed or set up another time to go back to the store with the idea that, okay, this time I'm actually going to make a purchase. I'll pick up an item and I'll make a purchase. Now, if it's too difficult for me, if it's a little too anxiety-producing for me to go to a live cashier, if I don't think I'm up to that challenge, okay, fine. Let's go to the self-checkout and let's do that. Okay, let's succeed there. Let's write out any anxiety that that I might be feeling, and success. I pat myself on the back. Then next time, maybe I actually go into the store, get an item, go to a live cashier at this point in time, and write out the anxiety there. Now, if I have to, I might have to use a what they call a safety behavior. So maybe when I go to the cashier, I have to look down. I can't look at her or something like that. Okay, fine. At that point in time, that's where we are. We're going to get past that. We're going to write out the anxiety with that safety behavior. Maybe the next time I go into the store, get an item, I go to the live cashier, and this time maybe I look at the cashier while I'm making the purchase. Okay, so you kind of do it in incremental steps. That's the way I like to do it. Some people like to, do it all at one time. The problem with that, it's great if it works. Problem with that is sometimes people tend to have a tendency to bail on the situation. I like to go with little baby steps. Now, in addition, I like to actually visualize the situation first. I can imagine that I'm going through the scenario, going to the store, whatever the scenario is. I'm tolerating the anxiety. I'm not necessarily eliminating it, but I'm tolerating it. Okay. I might, again, use that mantra like, I can tolerate this, or this will pass, or whatever you choose, as I'm going through this visualization process, or this imaginary process you want to, however you want to label it. Now, one more thing. With regard to exposure therapy, the recommendation during the seminar is, you don't use relaxation techniques while you're experiencing the anxiety in that particular situation. The idea is that maybe that kind of masks, your ability to learn to tolerate anxiety while it's happening. And, I agree with that to a point, and depending on the situation. If most situations that you're dealing with anxiety are not, real safety issues. But if you're driving a car, that could be a safety issue. In my mind, I would think, okay, if I've learned to relax and that helps regulate me in that particular situation, so I'm not going to get into an accident, that's what I would do. Okay, as opposed to just trying to write it out until I can actually systematically deal with a situation like that. And here's another example. Okay, I went to the dentist a few weeks ago. I don't go to the dentist that often, okay? So in my mind, I'm thinking, okay, there's really no need for me to just ride this out. If I was feeling, a little stressed, I've got the dentist, and she's got some sort of device that's making some screeching sound, and she's feeling some gap in my teeth, and I got another person over there who's got some other suction device, and that's sucking fluid out of my mouth, and they've got these headlights on that are shining in my face, and I'm wearing sunglasses, and even then I still have to keep my eyes closed. What I did is I did some breathing as they've got these things in my mouth, and this noise is going on, and water is squirting, and so I just did some 6 to 7 belly breathing. I did that, and I just got through the process, kept myself from getting too anxious, and it was fine. That's an example of not using the exposure method. That was more of an example of just, using a breathing technique, a relaxation technique to get through a particular situation. So there are particular situations where, okay, yeah, I'm just, it doesn't make sense for me to go through the exposure component. And in case of the dentist, for me, since I don't go that frequently, it made perfect sense to use the breathing techniques, and it worked fine. Anyway, I hope this is useful, and I'll have some other information about some of the little areas related to anxiety and safety behaviors and things like that. Okay, thanks.